Okay, class, besides the undernutrition problems that we have in Malaysia, like stunting, and then we have the iodine deficiency disorder, and then we have the anemia among pregnant mothers, among the young women, adolescent. We also facing the problem with imbalanced diet that is coupled with a sedentary lifestyle, which leads to an increase in the prevalence of risk factors for diet-related non-communicable disease, such as the obesity, diabetes, CVD, which is cardiovascular disease, and certain types of cancer. So both urban and rural areas are affected. So we are now, this is what we call, previously we call this as double burden nutrition, because we're facing undernutrition and as well as overnutrition. But now, currently, they expand it to triple burden nutrition, because besides undernutrition, besides overnutrition, we also have problems like stunting, and then we have other problems related to diet as well. Okay, next, the changes in dietary and behavior. So, in terms of changes in in terms of changes in Malaysian population dietary and behavior, what is happening is now, the food consumption pattern of the communities are shifting towards an affluent diet. So, affluent diet is what we call as the diet orang kaya. What we mean, like, the characteristic is more of the high intake of animal product. Okay, so we look at the characteristic here. So affluent diet means that they reduce intake of starchy staples, which means less of rice, less of bread, less of cereals, and then there's no increase in fruits and vegetables. There's increased intakes of fats and oils, refined carbohydrates. Refined carbohydrates, which means more makanan karbohidrat yang telah diproses. Okay, and then meat, fish, and eggs, an increased percentage of energy from fat, more increased availability of animal sources of protein, fat, and calories. So these are the characteristics of an affluent diet. So you need to remember what is the changes that happens in food consumption pattern of the communities, which is shifting towards an affluent diet. So you need to remember all the characteristics of an affluent diet here. So other changes in food behavior is that more families eat out nowadays. So it includes me as well, because we know that we have so limited time. And then, but how do we manage our dietary intake for those who specifically are working? Okay, so perhaps when kita boleh juga, macam kalau kita beli makanan kat luar, kita try to minimize the food outside and try to cook, but still we are struggling with working, and perhaps kalau kita pergi luar membeli, perhaps kita boleh bawa sayur-sayur tambahan ke, sebab kadang-kadang when we go eating outside, kadang-kadang vegetables are not adequate, for example lah. Okay, increase consumption of fried foods, increase consumption of fast food, overeating, and then increase serving size. Kadang-kadang bila kita tengok makanan antara makanan A dengan makanan B, kita tengok yang mana kelas, yang murah, and then serve in a larger portion. Padahal kita tahu we should eat less, reduce the quantity. Perhaps kalau kita makan yang portion yang besar, perhaps we can cut it into two. We share with our friends or our significant others. And then there's inappropriate use of nutrient supplements. There's a lot of crazy things happening right now in terms of supplement. People are nowadays are taking more food supplements. I don't know why, because we are encouraged to eat from the raw foods better rather than the supplements. In addition to dietary changes, there's also been a dramatic changes in the lifestyle of communities. There's significant rural-urban migration, there's decrease in physical activity, sedentary lifestyle also occurs in the rural areas, and there's also an increase of the cigarette smoking percentage. So the combined effect of these lifestyle changes is a significant change in the food and nutrition issue in the country. So this marked decline in nutrition deficiency and also increases in diet-related chronic diseases. So in order to cater this double burden nutrition problems, or we call it triple burden nutrition problems, Malaysia has set up a nutrition policy to guide the ministry on how or what we should do in catering this problem. So okay, so we have this Nutrition Policy Malaysia 2005. This is the first one, which is Dasar Pemakanan Kebangsaan Malaysia, which has clearly emphasized the importance of ensuring food and nutritional security. Okay, then you can read all of these things, what are their highlights to improve the situation in Malaysia. And the implementation is under the scope of National Food Safety and Nutrition Council, and the National Coordinating Committee on Food and Nutrition will serve as the coordinator and technical advisor. The policy will be translated into effective and viable plans through the revised National Plan of Action for Nutrition. So in order to deliver the message, they have come out with the National Plan of Action for Nutrition. So NPAM, we have several updated NPAM. So if you can see here, okay, we have the first NPAM, which is in 2005, and then we have the second NPAM in 2006 until 2015, and the latest one is the NPAM 3, which is from 2016 until 2025. So these are available on the website. You can search for it. I will not go into details, but you can have a read on each of these points. So these are some of the nutrition program and services in Malaysia. So you also can look in the nutrition society on the website, which is called the NutriWeb, where all the activities in regards to nutrition will be displayed. So in Terengganu itself, we have the Jabatan Kesihatan Negeri Terengganu, which will monitor all the things, all the situation of nutrition in Terengganu. Alright, so in here we have the nutrition research priorities. So this is the priorities that the Ministry of Health must be focused on, because if you still remember the community needs assessment, it has 7 basic principal steps, right? So the 6th step is to put priorities on the urgent situation. So these are the 7 areas that will be covered in the 10 Malaysia plan. This is from 2011 until 2015. If you can have a look, area 1 is on the infant feeding, area 2 is on the monitoring of national nutrition status, area 3 is on the food intake and healthy dietary practice across the lifespan, area 4 which will cover on the macro and micronutrient access and deficiency, area 5 is on the overweight and obesity, area 6 is on the diet-related non-communicable disease, area 7 is on the food composition database for nutrient and non-nutrient components. And you can click on this link to look at the books on the nutrition research priorities. But in 2016, they have come out with a new Malaysian priorities for the 11 Malaysia plan. So now we're waiting for the 12 Malaysian plan nutrition research priorities. So if you can look, it still covers the 7 areas, but with different perhaps more detail of the each of the areas. For nutrition research priority for 11 Malaysian plan, it covers maternal as well, maternal, infant and young child nutrition. And then they look at the National Food and Nutrition Security, nutrition status and programs, life course food intake and dietary practice, which is the sepanjang hayat pemakanan. And also they remain the macro and micronutrient access and deficiencies. And also they remain for number 5, number 6 as well, by including cancer, diabetes and cardiovascular disease, particularly and then also remain for the number 7. So it is still the same on the bigger picture, but with more details. So area 1 is on the maternal, infant and young child nutrition. So what important in here is that there is a need to have more studies in regards to maternal, infant and young child nutrition, because there's still a lot of things happening around maternal, infant and young child feeding practices. And we could see that there is suddenly an increase in terms of stunting among children under 5 years old. So that's one of the urge that needs that maternal, infant and young child nutrition as one of the priorities needed. And second is on monitoring and evaluation of national food and nutrition security, nutrition status and programs. So as I have mentioned before, we have the Malaysian Adult Nutrition Survey, and in 2002, 2003, and then in 2014, and another coming one is in 2024. So the gap is 10 years from one survey to another survey. And we also have the Adult Nutrition Survey in 2017. So all these surveys, nationwide surveys, are needed to monitor the national food and nutrition security, nutrition status of a population. So it is needed, the ongoing needed census survey. So besides, we are going to look on the behavioral factors that influence the nutrition status, and also the social and economic factors that influence them. And the area 3, which is on life cost, food intake and dietary practice, this is on our pemakanan sepanjang hayat lah. So more research are needed on nutrition related behaviors among these various age groups. So we want to know whether their current dietary intake would influence their health status in their later life. So, and then we're going to have on area 4, which is on the macro and micronutrient access and deficiency. So we need more innovative methods in terms of fortification of the foods. Perhaps for indigenous people, perhaps we can try to fortify their staple foods to improve their micronutrition deficiency for example. And then area 5, which is on the overweight and obesity. This is the current nutrition problems in Malaysia. So perhaps we could develop new modalities or new approach to treat this overweight and obesity, perhaps by giving functional foods or herbal or novel and practical intervention strategies, which we still are in the process of intervention. So perhaps by having new approach could reduce the prevalence of overweight and obesity, especially among the children. And area 6, which is on diet-related non-communicable disease. So we need perhaps to strengthen epidemiological data and evaluate community interventions program. And still, like the overweight and obesity approach, we need a new approach, which is the new modalities in diagnostic and treatment, perhaps by functional foods or nutrigenomics, focusing on the gene and develop novel techniques. And the last one, which is the food composition database, we urgently need research on this food composition database. So there's still lacking on new data on the FCD. So we need to improve the methodologies and more validation of the methods. Alright, this is the My FCD, where the updated of the Malaysian food composition database can be seen here. So this is the 1997, the buku hijau that you have used during your pemakanan kesihatan. So you can look at you can browse through the current and the industry foods. And then this is the National Health and Mobility Survey, plus the Adolescent Nutrition Survey, which I mentioned to you before, because math is only focusing on the adults. So this is practically a census survey on the adolescent in 2017. Okay class, that's all for now. Thank you for lending your time and hearing my lecture. Hope you have a nice day.